5:54. Welcome back. For this Momster Monday, we're talking about mommy makeovers, and you know, a little nip here, a tuck there, a lift there, perhaps. And I can speak from personal experience. After having kids, your body changes in ways that even exercise can't help in certain ways. Get creative, you'll know what I'm talking about. But we're talking about mommy makeovers with Dr. Robert Cohen from Scottsdale Center for Plastic Surgery.
That's right. Thanks for having me.
Thank you for being live with us this morning. He's twice recognized as the top doc with Phoenix Magazine. So we talked about plastic surgery. There has been a stigma socially for being shallow, but then it's becoming more socially acceptable for these mommy makeovers, even in a down economy.
Correct. Well, I think in general that the stigma of plastic surgery is starting to fade away now that moms realize after they have kids, there's certain things that they can't do to fix problems without, even with diet and exercise, they find there's still loose skin in the breast or loose skin in the abdomen. It can be very frustrating and demotivating for them sometimes. So they're looking to something to help them get back their bodies that they had before pregnancy.
I was pretty surprised to hear that in this economy, women are still making this a priority. They're like, you know what, yes, we're going to cut things here and there in our budget at home, but this is a priority for me, and I'm going to make this happen.
Yeah, I think it is. I think women want to look their best if they're looking for jobs or working in the workforce now. They want to feel as good as they can and have the self-esteem that they had before having kids. So I do find that the economy doesn't seem to be an issue, and moms are just going ahead and finally taking care of themselves after they've spent so much time taking care of their kids and their families.
I would have never considered it, and I have a couple sisters and friends who said the same thing. Never would have thought about any plastic surgery. Then you have kids and you're like, okay, a couple of them gave in and got some boob jobs here. So talk about, I mean, the full mommy makeover, yeah, you get a boob job, but what other things are being done?
Yeah, mommy makeover it's not one specific type of surgery. It's very customized to each patient. Sometimes it involves breast augmentation. Other times it actually could be a breast reduction or a breast lift or a combination. And then usually a tummy tuck or a mini tummy tuck and some liposuction for certain patients. So it's very designed to what the specific problem is for the patient. And when patients come in, they have an idea of what's bothering them, and then I work with them to make sure that we're on the same page as far as what can be done to make them feel as good as possible about themselves.
Okay, so most moms take a little bit of time off once we have the babies.
Absolutely.
So what's the recovery time on the backside of a mommy makeover?
It depends on how big surgery you're having. On the smaller end, maybe a week or so to be back to sort of light activity. Some patients maybe a couple weeks if they're having a full tummy tuck. I always recommend getting a grandma or somebody to come stay at the house for a week or so and help take care of the kids, especially if there's a lot of young ones in the house.
That sounds good anyhow.
Patients never complain about that aspect of things.
Dr. Robert Cohen, thank you so much. And we put a link to his website and Scottsdale Center for Plastic Surgery on our morning show webpage. Go to kpho.com and join the conversation. It's 5:57. We're back with more of the day's top stories on this 4th of July.